All right, let's go over the area of sterilization, starting with our first input portion. We have someone that's usually going to come and dump instruments on my area, especially if I'm here specifically for sterilization, and someone's going to joyfully go and lay instruments down for us, or we may bring something over here. Hey, I got a live one for you. Merry Christmas. Feliz Navidad. Happy Hanukkah. Order up. Happy belated birthday. Happy Valentine's Day. But before we even touch anything that happens over here on this side, we're gonna make sure that we go and glove up, because if there's no glove, you ain't gonna have that good of a time over here in Steri. This is the dirty side of sterilization. So always have gloves on and ready to go. And let's go and look over here at our instruments. It looks like we have a basic setup: Explorer, a cotton plier, and a mouth mirror. Well, before we go and dump them over here into our ultrasonic cleaner, let's go and inspect our instruments first. Bring it a little bit more closer over here to our sink. And so I have my Explorer, and that's looking fairly decent. I'm looking up and down its little tooth and the little serrations on the handle. I go over here to my mouth mirror, and the mouth mirror does good. Nothing in the teeth, and that'll make me suspicious of it. But then I go over here and look at my mouth mirror, and it looks just fine. On the mouth mirror side, look, you can see yourself in there also. But if we turn it over here and look all around,
What the f?
well, that's a bad situation. We need to go and make sure that we clean this. We don't want to just go and automatically just dump this into that bath water, because everything's going to get contaminated that's going to be in there. So one thing that might be happening is, depending on your office and the policy or wherever you work at, what state you work at, we're going to go get this cleaned. Going over here to this little bin that you may or may not have, at least a sink that you'll have in your Steri area. We're gonna go and give this either a good little brushing, depending on where you are and if it's allowed, or we're just gonna give it a good old wipe. I'm gonna just give it a good wipe down, and what I can go and do that with is our disinfectant that we have in a nice 4x4 gauze. Get that nice and down, get this good and wiped up. Takes care of all those different microorganisms and germs and everything. I'm gonna give this a gentle little rinse. And I'll give all these instruments a rinse because it's been through that same procedure also. And also, don't forget to get your tray as soon as possible. Depending if it's soaked in blood, you may need to go over to your biohazard waste area. If it's sharps, you need to go into its sharps container or into its general waste container, depending on what you have. So we go and toss that in the proper place. And now we're gonna go and handle our instruments here. After being nice and gently rinsed, we're gonna go and put them in our ultrasonic. But you don't want to just go and just slam dunk it right into there and create a splash. We're gonna go and do this nice and correct. So I'm gonna bring this little basket out. Put these gently in there and go ahead and resubmerge them in that ultrasonic cleaner. Now, if you visit the other video on how to set this up, that's awesome. But this is already set up, and I'm just gonna go and close my lid on top and select the time frame I want it to go and shake it at. So I'm gonna open it on for about 6 minutes or so as I go and hang over to these other instruments. I'm gonna let it shimmy and shake for about 6 to 12 minutes or so as I go and move on to these other instruments. So now that we're over here and those are over there shaking right now, we're gonna go and handle these different types of instruments apart from hand instruments that we might use every day. We have our handpiece, and depending on the handpieces that you might have, and make sure you check with your office because some of them might not need this, you're gonna give them a good gentle wipe down with either isopropyl alcohol or some type of disinfectant that's proper for handpieces. But also when it comes to lubricating, some handpieces are lubricant free, and if you accidentally lubricate it, then it turns into a always needs to be lubricated handpiece. So watch out for that. And with that lubricant, you're going to need some handpiece lubricant that is going to be supplied by your office, hopefully. And that's going to keep them nice, fresh, and easy moving so that there's no issues. And that's what we have for this. Another thing that's going to be common that will go into our handpieces is going to be our different types of burrs. They can be shaken through with this little mesh basket that's going to hold them nice and tight. I can go put this off to the side. And as we inspect our the little flutes of our burr, and if you go through and there shouldn't be any gunk or anything left over, so this is going to be decent for sterilizing. We go over here to our hinge instruments, and hinge instruments are a little bit special because fun thing that can happen is where that hinge is, if we don't sterilize it correctly, can lead to rust developing inside this hinge, causing us to have a not so easy open and closing action. So you might use some surgical milk or some type of lubricant to make sure to keep this nice and lubricated. And when we go to autoclave these, we may autoclave them in an open fashion just like I have it here. So that might be something that your office does specifically. Some items will not be able to be sterilized in our autoclave that we have over here, such as our little impression bowls that we might mix alginate or stone in. This isn't going to fit in there that well, so we are going to give this a nice disinfectant spray down inside and outside. You give it a good disinfectant time and wipe down, and it'll go over to Steri. Same thing with our patient goggles that may possibly melt in there. Good spray down, top and bottom, give it enough kill time, and then we'll move on to the sterile side. Then we'll move it on back to the offices or to the drawers. Going back to these instruments though, when we go and load these instruments into our little pouches, we need to take a note of our pouches because they will start off with this pink type of color at one of the corners. This tells us that this has not been cooked yet, or autoclave. So when we go and use this, we need to make sure that whatever goes into our autoclave is going to be uncooked, and then when it comes out, it will look cooked. And when we look at this little example right here, this is an uncooked side, like I mentioned, that has that nice pink layer, that pink dot over here on the side. But when we go to one that has been through the autoclave, through the sterilization process, this little indicator has changed from pink to brown. This tells us that it's at least been exposed to steam for hopefully this amount of time that's needed. For those instruments, when we go put them in the pouches, we want to make sure we use the correct size. So when I have it in there, this nicely fits here. If you need to find the correct size, well, right now we have our little cabinet that's going to have sterilization pouches that even has a little guide on what should be able to fit in a certain size. We have large ones, thin ones, short ones, ones for burrs, all the smorgasbord that you might want. So choose the correct size as you go about this. There's going to be a specific little line at the top where you go and pull this tape off, and then this little dotted line that you're going to go and fold this little lip flap over onto itself. This is a must. You cannot go and fold it in incorrect way. Now that this is folded on that nice dotted line, as I mentioned before, we go over to the rear of our instrument pouch. And now, with this, we need to label it somehow. Your office may have a stamp or some type of dating system that they go. Right now, I'm just gonna go put the initials, so it's the person that packaged this instrument, and today's date, so I know when it got sterilized. You may have additional information or less information depending on your office. But we go and move on to actually getting it into the sterilizer. But 1 second, there might be stuff in there. So before we get too far, let's go and put this in this little holding bay for now until we can go and assess the situation. Going over here to our autoclave, I'm just going to go and open it. Your door may be locked and latched, so what I need to do is pull up on the latch, and then pull outwards and swing it on open. And we can go and take a look at what instruments I have in store. Here's a couple examples of a bad pack in the autoclave and a good pack in an autoclave. So on the good side, we have all of our instruments with our plastic side down, paper side up, and they are nice and Tetrised out, so there's room for everything to be in there. And if we go and inspect our little corners of these packages, they should show up with this nice little steam indicator that says it's been cooked. Going down into here, I know that these have been ran through with autoclave, so I can go and just take the tray and move it on over to my holding bay so that it can get properly placed in its proper drawers, in its correct drawers. Let's go down one more tray and inspect some of these instruments.
What? What the f?
Oh well, now hold it here. There's something going on. For one, this is not a good Tetris player. They are not lining these up all in a good straight manner. These instruments are so jam-packed together that the steam is not going to be able to breathe itself onto the instruments and get all those microorganisms killed and germs deadened at this point. So this is not a good situation. Also, another thing is that the plastic side is up, paper side is down. It's controversial, but typically it's going to be that other version. Remember, paper up, plastic down.
Just do it!
So these may need to go through another cycle because I don't trust that these all got hit with the correct sterilization process that we might want to. So I'm going to go and Tetris these up right and give them another run. That's a little bit better. Now, before we get started on any of this, let's go and add that little holding bay instrument that we had here and put it on a proper tray. Right now, I'm just going to sit it down here on its own. And we can expect our autoclave to make sure that it's ready to go. Let's start over here with our door. Our door is going to have this gasket that's going to help keep the steam in so that pressure can build up in our oven to go and kill everything. With that, you want to inspect this gasket to make sure it's not ajar or hanging off. Usually it's going to look something stupid like this. Make sure to go and put it back in its right position. Give everything a nice little wiggle so that it's not in the wrong place or anything. And we can move on to our next part, which is our water tube. If we go over here to this water tube, we notice that we have a red, a green, and then we also have this inspout to go and deliver water into the system. So if it's red, you need to stop and fill it up a little bit more. If it's green, green means go. So awesome. And if we need to fill up more, we always use distilled water. Never use tap. Distilled water is the way to go, or else you'll get error messages when it comes to putting these all together. Let's go ahead and close our actual door, bringing it a little bit closer to closing. Lift up the latch, deliver the latch in, and down with the latch while pushing down. Cool, now that we have the door closed, we can go look at these little buttons that we have. The main thing is you're gonna stick to the presets that we have here. Unwrapped, pouches, packs, and hand pieces. Unwrapped if your instrument's gonna go in bare. Pouches if it's going to be wrapped in a pouch that we talked about. Packs if it's a specialized pack that your office may use. And hand pieces if there's a specialized method that the hand pieces need to be sterilized. Right now we're all pouched up, and I'm gonna hit start, and then I'm gonna go walk away and do the rest of my instruments in stereo or back to the room to help the next patient. And that's our sterilization process in a nutshell. Hopefully you got this. Review the video again if needed, and we're gonna be going on. Miller out.